Happy
Right.
Thursday. How are we? We're live on a Thursday night. This is Therapy Thursdays. Letty Garza here with Epic Consulting, providing a space for these conversations. And we're here with the Henrietta Weill Child Guidance Clinic clinicians and their fearless leader, Kanuli. Do you want to say a few things before we start?
Just we're glad to be back. Welcome to Therapy Thursday. Thanks again, Letty, for bringing us on. And I think both Natalie and Yanni are fearless leaders in their own right. So I'm very thankful for them for popping on and helping us all out.
Absolutely. Okay. Let me get the slides up. We're going to be talking about anxiety today. And just like with our depression conversations, we'll have a two-part conversation today and then next week because they're important topics and everyone's impacted by them one way or another. If not personally, then definitely within your sphere of influence. So let me get this going here. Okay. So like I said, this is anxiety. And Yanni, if you want to go ahead and get started.
Okay. So I think Kanuli was going to.
Yeah, I was going to just cover the DSM-5 on it and then pass it on to Yanni.
Okay.
So if that's okay. So I think Natalie shared when we first started that DSM-5 is kind of the manual. And in fact, that's the name, the Diagnostic Statistical Manual. Help me out. I'm so used to calling the DSM-5. I'm forgetting the acronym, but DSM-5, that's kind of the Bible that we use to help us. Yes, read it to us, Natalie. What does that say? Diagnostic.
It's Diagnostic and Statistical Manual of Mental Disorders.
That's right. And so that manual is what we use to diagnose, therapists will use to diagnose based on the symptoms that are presented. And so that's a very helpful manual. And so for the DSM-5 anxiety disorders, there are a slew of names that represent symptoms of anxiety. We are going to focus on generalized anxiety disorder, but I want to just share what some of these other anxiety disorders are. There's separation anxiety disorder. And that's when a kiddo is feeling, you'll know when I had it when I was a little, but with separation anxiety disorder, this tends to be a disorder that parents will recognize with their kiddos where they have difficulty being away from their parent. And every kiddo experiences that. But with this diagnosis, it is severe enough to interrupt people's or kiddos' day-to-day activity. They'll get physically sick. They won't even fun things like spend the night at their friend's house. They won't do that because they do not want to be separated from their parent. That's separation anxiety disorder. What do we have next? Selective mutism. What's next? Specific phobia. What's next? Social anxiety disorder, social phobia, panic disorder. A lot of people say, I have a social anxiety disorder, and they really just mean I feel anxious when I'm around people. But again, we all get anxious or nervous or worry, but that's different than the actual disorder. Agoraphobia, that's a popular one. People are familiar with agoraphobia. Generalized anxiety disorder, which is what we're going to focus on today. And substance medication-induced anxiety disorder and anxiety disorder due to another medical condition, which is basically just what it says, that it is not really because of a chemical imbalance specific to anxiety disorder, but that it's brought on by substance abuse or by medication or a medical condition. All right, now we're going to get to the meat of the issue. So many GAD, generalized anxiety disorder symptoms, mirror those found in depression. And we kind of, Natalie, I think, talked mostly about that when we first met. Sometimes this makes it difficult for the healthcare professional to properly diagnose the disorder. When individuals are misdiagnosed, they do not get the treatment they need for generalized anxiety disorder. Let me tell you why this is important. A lot of the clinicians, when they're completing an assessment, will call me and they'll say, I'm not sure this kiddo has symptoms of depression and they have symptoms of anxiety. But again, as Natalie shared, sometimes the symptoms overlap. You can see both. And even in the DSM-5 with depression, they added a specifier that speaks to depression with anxiety. Okay, so generalized anxiety disorder. The individual must meet all of the following criteria in order to be diagnosed with the disorder. Let's look at this criteria. With kiddos, okay, excessive anxiety and worry, apprehensive expectation occurring more days than not for at least 6 months, about a number of events or activities, such as work or school performance. With generalized anxiety disorder, it could be about anything, not a particular life event. The individual finds it difficult to control the worry. You know, some people are able to push through. They're like, I'm thinking about this, but I'm going to distract myself with this so that this doesn't dominate my thought life. It is with anxiety. We kind of talked about this. You brought this up, Letty, I think the last session, intrusive thoughts, where it just thoughts intrude and you have difficulty blocking the thoughts. Can't control it. The anxiety and worry are associated with 3 or more of the following 6 symptoms, with at least some symptoms having been present for more days than not for the past 6 months. Restlessness or feeling keyed up or on edge, being easily fatigued, and just like, okay, so I'm just gonna go over some of these things. We talked a little bit about psychomotor agitation, which was in the DSM-4 when people are depressed, and that's that moving. You see the restlessness here. Being easily fatigued, also that is something in with depressive symptoms. Difficulty concentrating or mind going blank, also with depressive symptoms. Irritability. Muscle tension. Sleep disturbance, also with depression. Difficulty falling or staying asleep, or restless, unsatisfying sleep. With depression, we call it like irregular sleeping patterns, but with anxiety, your sleep is actually interrupted. Note, only one item is required in children. So with adults, you need, I think it said 5 of those, but with children, only one is required.
I want to pull us out just for a second because I was wondering why that was the case. Is there something you can share about? Because it seems like some of those things, they could just be like childhood things, like I'm having trouble sleeping, growing pains, and so it's messing with my hormone imbalance because I'm a preteen or whatever. Is there something more specific that makes it so that you only need one of those things for a child?
As a child, I'll tell you a thought that comes to mind. I don't know that there's actually any science to it, but I'll tell you, what my thought is. Again, most of these symptoms create, in order to get the diagnosis, these symptoms create an impairment of functioning, like a person is not able to function. With a kiddo, it's just one that prevents them, that the impairment is so severe. So I would venture to say maybe with as an adult, perhaps you can, we have so many cylinders to function on, the saying functioning on all cylinders. With adults, you can have 2 cylinders down, but those other 2 are functioning, so you're able to move ahead. But I think with kiddos, they probably don't have the same ability, resilience, I think, because with adults, we might be restless, but that restlessness is not going to create an impairment in our entire functioning. But with a kiddo, that one restlessness is probably so severe that it impacts their schoolwork. Whereas adults, I think we probably have learned how to deal with things differently, and maybe we're able to push forward differently than a kiddo would. So that
Okay.
would be what I would.
Yeah, and then I guess I can go back to the slide, but then it does
Yes.
say it has to be the time, right? Is
Mhm.
also what's important.
Mhm.
That
6
it's not
months.
just what we would normally
Once.
say about.
Mhm.
Yeah.
Mhm. Mhm.
Okay.
Great
That
question.
does make sense. Okay, so here we are.
And this is kind of what we were just talking about. The anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational. With kids, it's a school instead of occupational, or other important areas of functioning. E, the disturbance is not attributable to the physiological effects of a substance. For example, what we talked about, drug abuse, substance abuse, medication, or another medical condition. For example, hyperthyroidism will cause someone to feel kind of the same impact where they have the sleep disturbance and on edge. The disturbance is not better explained by another mental disorder.
On that one, because we did have a list on this
Mhm.
slide about all the different things, but can you just give examples of maybe a
Bipolar.
handful of things
Mhm.
that
Yeah.
might.
Mm-hmm. The thing that I was thinking of is a mania. When someone is manic, they have the same keyed up restlessness. They definitely have a sleep disturbance. In fact, they're not sleeping as much. Mania. Sometimes we see mania as, I know we're not talking about this, but a lot of times we see mania when people are super happy. I can win $1 million trillion. We can do. They're like that. But another aspect of mania is irritability. So. Some of those symptoms can look the same, I would say.
Okay. Whoops. Sorry.
Okay, so here's where I'm going to kind of go into the cycle of anxiety. So at the very top, so a trigger, so an anxiety-producing situation that leads to uncomfortable symptoms such as worry, fear, a racing heart, sweating, or a feeling of being overwhelmed. That later on leads to avoidance. So those uncomfortable symptoms are controlled by avoiding the anxiety producing situation. So, for example, an example of avoidance may include like skipping class to avoid giving a presentation, or using drugs or alcohol to numb those feelings, or procrastinating on challenging tasks that then move on to that short-term relief from anxiety. So avoidance of the anxiety-producing situation gives an immediate sense of relief. The symptoms of anxiety do lessen, but it's only temporary, which then later becomes a long-term anxiety growth. So the fear that initially led to avoidance, it worsens. And then so the brain kind of learns that when the anxiety-producing situation is avoided, the symptoms go away. So as a result, the symptoms of anxiety will be worse the next time, and avoidance is more likely. So it's kind of that cycle. It's just anxiety will kind of worsen as that cycle keeps going. Oh, next slide.
Can I just mention something real quick?
Yeah.
Because I mentioned like the whole a trigger happens to create the anxiety. I do want whoever's viewing to know that sometimes there isn't a trigger to the anxiety. Sometimes the anxiety just comes up without anything happening. So I just wanted to comment on that.
Yeah, and it's just okay. So I guess Yanni's going to share that. I thank you for saying that, Natalie. It's just like depression. We talked about how the difference, and we'll move into that. But when people are, everyone has kind of a sense of like worry or nervousness, but it tends to be specific to a situation. Whereas with true anxiety, you don't like Natalie was saying, you don't even need a situation to create that feeling of anxiety.
Okay, so did want to kind of talk a little bit about some causes. So causes, risk factors for anxiety can be many things. So trauma, stress due to an illness, stress buildup, personality types, other mental health disorders. So kind of like we've been talking about how depression and anxiety are linked most of the time. It's also genetic, drugs and alcohol. So going back to the personality type, so people who tend to be very shy are more at risk of an anxiety disorder. And I know we kind of talked a little bit about other underlying medical conditions. So things like that, those are other causes, risk factors, a history of anxiety or other mental health illnesses in biological relatives. Like I mentioned, exposure to stressful and negative life or environmental events in early childhood, so trauma. So those are just some of the causes.
I'm stopping here for just a second because we have a comment with a question from our social media, and I think this is probably it'll be a good segue, I think, to you're actually going to be talking about some of these things. So Sally says, so then if a child experiences environmental trauma and then out of nowhere fears school, and then in another message she said like they refuse to go to school, could this be anxiety?
I think it kind of goes back to what Kanuli was talking about earlier about how long it's been going on for, and then just where is it affected. So in this case, it's school. So school performance, it's being affected. So it'll just kind of depend on the time frame.
And that was great, Yanni. I just wanted to add to that. Anyone can experience anxiety, and it may not be the generalized anxiety disorder. So environmental trauma can create a person feeling anxious, feeling distressed, but it may not be okay. So I remember times when I didn't want to go to school at all, but it wasn't significant enough or severe enough for. I'm sorry, I'm at my office, so their janitorial is outside. Sorry if you can hear the vacuuming, but it wasn't necessarily. I wouldn't have met necessarily the criteria to be diagnosed because it didn't severely impair me. I just felt anxious. So you can feel anxious. That's the human condition when things come up. And just as you mentioned with your daughter, there's a specific situation that happened. So it makes sense she would feel anxiety. Sometimes even separation anxiety, I find, is caused by something traumatic where the kiddo doesn't want to leave their parent because something happened. But then sometimes a person can just inwardly feel anxious without having that anxiety, without having that generalized anxiety disorder, without being diagnosed with that, because it's not creating that significant impairment.
Okay, so worry versus anxiety. So worry and anxiety, they fall on a spectrum. So they're different states, but they're also interrelated. Okay, so for worry, worry tends to reside in the mind. So everyday worries take place in your thoughts versus anxiety. Anxiety affects both body and the mind. So anxiety often manifests physically in the body. You might feel faint, lightheaded, Some people even hyperventilate. People who are anxious are also more likely to suffer from digestive problems like nausea, indigestion, and irritable bowel syndrome. So with anxiety comes verbal thought as well as that mental imagery. So it's not just this passing thought of, oh, I'm worried about this thing, and then it goes away. It's this mind and body thing where it's together. It affects kind of all together, if that kind of makes sense. Worry is very specific. So worry is distinct and concrete. So for example, with COVID-19, an upcoming event, it is a response in an identifiable threat. Anxiety is more generalized. So anxiety is generally vague, kind of like Natalie mentioned earlier. Sometimes we don't even need a trigger. It just comes out of nowhere. So anxiety, it's generally vague. You feel unsettled, but you can't pinpoint what you're really anxious about. And that can make problem solving very difficult, where it begins to affect your everyday life. I think this is the same slide. Okay, so worry is grounded in reality. There's a logical component to worry. Your brain is trying to make sense of a real and present danger. Worrying when your fears are actionable makes sense. It's worry that can lead you to take COVID-19 precautions like washing your hands and wearing a mask, versus anxiety is marked by catastrophic thinking and overestimates the risk. So for example, if the real risk of a negative outcome is 10%, someone who is anxious may perceive the risk closer to 70%. So you tend to kind of pay attention more to that worst case scenario versus that lesser part of what can really happen, seeing more of the negative side of things versus the positive side of things. So when suffering from anxiety, one's ability to cope with the negative outcome is very underestimated. For worrying, worry is temporary and short-term. Worry can encourage people to use problem-solving skills to address concerns. Versus anxiety, anxiety is long-standing and persistent. Even when concerns are unrealistic, it often compromises one's ability to function. So again, it really gets in the way of everyday living, so building relationships, school performance, things like that. It really gets in the way of just everyday living. Worry doesn't impair function. You probably won't be forced to take a sick day due to worries about finances or weight gain. Versus anxiety, it impairs function. It can seep into your psyche and can make it difficult to focus and complete tasks.
Okay, I want to take just a second here because the examples that we're using for COVID-19, I think, are obviously still relevant. And I feel like you can probably give some examples. We can all give examples of even in our own families, but definitely what we've seen, right? How things have been portrayed in the media, what we've seen and heard about the different ways that people have handled for the last almost year and a half, the pandemic. So you touch on it. But can we talk about specific examples that people could say like, oh, okay, that's a typical worry because people are dying and wasn't safe. And then maybe you can think of some examples off the top of your head. I can think of a couple where you saw something where you said that person is suffering from some kind of like higher level anxiety, kind of to illustrate to people, listening.
We just saw our beloved Isaac, who's like our second in command at CGC, resting on Natalie's lap. And not that this was Natalie's concern, but I remember as a first-time mom, I was always so worried that I'm not, oh my God, something's wrong with the baby. I remember looking in the crib and, newborn babies are just super still until they're not. But, newborn babies can just be so still. And I got, oh my God, he's dead. Or, I had to shake his little feet to make sure he stirred. And those are typical worries for new moms. Now, if I ran to the hospital every day, I'm depressed, I can't function because I'm so worried something's wrong with the baby, then that's how you know that, okay, this is not just general concerns that new moms have. This is more anxiety. If, I can't take care of my grooming, which new moms don't do that anyway, but let's just say, I'm running down the street, knocking on people's door. He something's wrong with my baby, like all the time, where my peace is disturbed in such a way that it creates this dynamic where people are checking in. Are you okay? That's when it has moved beyond just regular human worry to anxiety, something more severe and significant. That's an example.
Do you think we'll see more even now? And I don't know, I have no stats to back this up, but it seems to me that people, especially people, and I guess we could use Natalie as an example, people who have had babies, maybe for the first time during this time, to then, because I know that we all felt like you're saying that anxiety about whatever it is about having an infant, but then there's also anxiety associated with taking the child outside and meeting other people, just in general. That's terms, right? Criteria. But now, this year, like, do you think that could be heightened because, new parents maybe have other worries on top of the normal new parent worries?
If you guys, I'll respond to that. I do think that, just like when we talked about depression, if you don't yet have the chemical impairment, the serotonin, for example, the endorphins, beta endorphins are not kicking up, increasing. You may not have that yet, but if you continue in a steady diet of situational depression, then it creeps into the chemistry of a person, the physiology of a person, and can create that in their brains, the chemicals. I would say there are some people who may, I think Yanni kind of alluded to that, their personality is one that they may be a little more anxious. Some people call it anal, although nothing's wrong with being a little bit. So let's say someone feels a little, kind of more anal retentive, or they're a little more uptight about things now in the face of COVID. Then what is generally their personality, it does have the propensity to kick them into a generalized anxiety disorder. So that is something to be aware. There are things that can happen in the environment that can trigger people into a diagnosis or a disorder. That's the sad state of affairs. That's why we have been stressing, and we've heard a lot about, our HR manager said that, and a lot of, like in HR, one of the ideas is to be compassionate because of COVID. We're trying to just encourage and reinforce the idea of maintaining your own emotional health, particularly in this kind of environment, because this can absolutely kick someone into a greater level of fear than they typically experience.
Yeah, I kind of want to comment on that for sure, that I do feel like this whole COVID situation has definitely added some anxiety, even more than usual. I know for me, being a first-time mom, I'm sure I'm worrying about the typical things that everybody experiences, but now on top of that, I'm like, okay, anytime someone tries to get near my baby without a mask, I'm like, hold on, like, what's happening here? Like, my anxiety levels raised up really high. And then not only just about me, but like just some clients that I've had, I know lately during COVID, like, actually, it's interesting because for some it's raised their anxiety because they're afraid of, getting sick or their family's getting sick or they've had like members, and so now they're like aware. But then it's also caused the opposite effect. Remember, Kanuli, I kind of talked to you about it, where it's like some of our kiddos that have social anxiety have a little bit thrived off of it because they're not having to be around other people. So it's actually pretty interesting because it's kind of going both ways, where it's raising anxiety, but then it's like lowering anxiety for other people.
Like introverts are having a ball. Well, when COVID first started, it's like, yeah, streets were quiet and they could burrow in, and their environment supported it. So yeah, that's absolutely right.
That's a really good point. I just wanted to make sure that we address that, because if people are suddenly feeling this and have been feeling it for a long time, and there's one thing to worry, but then the prolonged, causing you to not be able to deal with your normal day-to-days, whatever the normal is. If you're working, if you still have to take care of, you still have stuff that needs to be taken care of. So we're all feeling it, but it could be worse for you
sure.
if you're susceptible to that, I guess.
I remembered we were doing, Yanni, I think you were helping me with this. We were doing a coping skills, stress reducing techniques in COVID. I think we were doing that for one of the schools. And one of the things that it said was, these aren't the words, but what I understood was stay away from environments that stimulate or reinforce or create more anxiety about COVID. So, for example, we need to be informed. Do we need to be over-informed?
Yeah.
Do we need to watch? So some people are watching the news like 24/7. Let's see. Let's look at the stats. Margaret, don't go outside. Whatever you do, you keep, shut the window and lock the doors and hide under the bed, because Amazon packages don't touch the Amazon packages because we don't know. And then we found out that COVID it didn't have sustaining power on surfaces, but people who got that first bit of information that it was on packages, they're like, what are we going to do? It's airborne, So in seasons like this, global pandemics, we talked about this before, we have to monitor what's coming in so that it doesn't kick up more or drive the anxiety to increase.
Yeah, and then also knowing your sources too. So social media, not everything's true on there. So knowing where to look for your information too. So that was one of the things that we did talk about, where know your sources. Don't pay attention to everything.
That's
Don't
a great
listen
point.
to everything.
That's a great point. And you guys kind of already answered this, but I'm going to just offer this up again. Sally is asking, so this is about that continued anxiety and whether or not it can lead to something like a breakdown, what we would consider a breakdown, or if we're ignorant to these things, what we would see as a breakdown or think of as a breakdown. Holding it together is much more difficult, and your physiology takes over. Is this more of like a fight or flight, or responding chemically, maybe?
Yeah. Do you guys want to answer that? You want me to get it? I just don't want to, I don't want to monopolize. I'll answer, and then, whatever you guys. So I think, Sally, it sounds like your question is, will it increase? Like if you have anxiety, does it continue to get worse and worse and worse and worse and worse? And so, I think it goes back to what we were sharing, in that you can have the kind of worry and it just be the human state. And then I think you can just worry and then stop worrying, because in other words, because you worry about a situation, it doesn't mean that it's going to kick into generalized anxiety disorder. So a person just is a human condition, just like we were talking about COVID. We were all kind of concerned about COVID, but it didn't create for most of us an impairment. It's just worrying about a situation, or, like we were saying about kids, you know, as your parent, you're like, oh, my kid, or I'm worried that such and such is going to happen. But it doesn't, if you start worrying, it doesn't necessarily have to kick into generalized anxiety disorder. I hope I answered your question, or I understood your question correctly.
If I can add to that, I think it also has a lot to do with how you cope with it as well. So it doesn't like overlap, where it causes this breakdown or this loss of control. So that's really important too. So we will go into coping skills as well, but that's really important to how you cope with it.
Something you said on that screen when we talked about the anxiety, the cycle of anxiety.
Oh, yeah. So avoiding it's not going to help.
Right. Yeah. Because avoidance, it's what you were saying on that cycle of anxiety about avoidance. And the issue with avoidance is that avoidance means you never learn to cope. You never learn, how do I get out or move out of anxiety in healthy ways. So something to share.
And kind of like what I mentioned earlier, like it does create this, relief, it will go away, but it's short term. And as you continue to avoid it and cope in unhealthy ways, avoiding it, it will worsen it long term. So it really does matter how one copes with anxiety, with symptoms of anxiety.
Okay. And so we'll talk about coping skills.
Okay. So lazy 8 breathing. So this is the majority of the kiddos that are on my caseload, I have a lot of little ones. So I've found this very effective, very easy too, because you don't always have to carry this infinity sign with you everywhere. It can be imaginary in the air. So it's a deep breathing exercise. So what you would do is you start in the middle where that star is at, and then as you inhale, you're tracing that one loop. And then once you reach the center again, you exhale as you complete the 8 that's laying down, which is lazy 8. This has become very effective with a lot of my littles that I see at the office. And it's, like I said, it's a deep breathing exercise. You don't need anything with you. You don't need to take anything with you. All you need is, this is the way I explain it to them, all you need is your finger and your breathing. And you just kind of trace it. You can do it even like on your hand, I've told them before, on your leg, on a desk if you're at school. And it's a form of reducing those symptoms of anxiety.
It's great for adults too.
Yeah.
Right.
You're right. Yeah, I've taught it to parents as well, so they can kind of guide their little ones too through it. Yeah. And it's, like I said, you don't need anything with you. All you need is your finger and your breathing, and to reduce the symptoms of anxiety. So grounding, so being in the present, paying attention to what's really going on. This is another one. I have these little cards that I give out. And so you use your 5 senses. So on one side on this card, it guides you through that countdown, the 5, 4, 3, 2, 1. And then on the other side, it gives examples of things that you can use for that, for that example. So you would scan the room. So 5 things that you can see, such as the sun, people walking. Then 4 things that you can feel, such as the wind blowing. It's been pretty windy outside, so that's something you can feel, or the pencil in your hand, and describe how it feels as well. 3 things that you can hear, like a car horns, birds chirping outside. Then 2 things you can smell. If you're at school, little food from the cafeteria or anything in the kitchen. Fresh cut grass, and you can pick things up and just smell it. I've had kids in the office kind of just their hair, smell your hair, what does it smell like, your top, what does that smell like, and just kind of anything that you have access to. And then the last one thing you can taste. So your breakfast, toothpaste, a mint, or I'll have them kind of pick up something if there's something that they can taste in front of them and describe that to me as well. To kind of, as a form of being in the present rather than, focusing on everything else that's anxiety producing, focus on what's real, what's going on right now, coming back to the present.
Okay. Thank you for those. And I'm glad that we had visuals on those. I do have some others to share. And I don't have these in any particular order. So if there's actually, I think I know who sent this one in because she kind of talked about it before. So I'm going to say Natalie. Do you want to talk about ASMR, please?
Yes, that was
as
me.
A coping.
So, I did talk about it at depression, but ASMR is more for anxiety, in my opinion. I know personally, this is one that I personally use. I tend to get anxiety at night that does not help me sleep. So the reason why ASMR can be a good way to deal with your anxiety, especially like at nighttime when you are having a hard time going to sleep, is because it's a good way to distract your mind. You start focusing on what they're doing in the video, which is the tingles. It helps you kind of feel relaxed. And it's just like, one of the things about anxiety is to distract yourself, not avoid, distract, from whatever feeling or thoughts that are coming to your brain. So watching these ASMR videos or just any videos, I guess, just in general, are good to help as that kind of thing, as a distraction.
And is this just you go looking for videos to watch, or is there like a list of things probably somewhere that says do these things? Is it because it's a sensory thing, right? So is it about just watching, or is it actually feeling? Could you feel things? Are there like strips that you can put on your desk and feel them, and that's supposed to be some kind of sensory? Is that the same thing, or is it something else?
Well, with the ASMR, they're just videos of somebody else making like noises, and it's the noise that makes the sensory stuff happen. And so I would encourage, like, there's different types of ASMR videos. There's, hair brushing, there's like massaging, there's like being all up in your face, or tapping. Like, there's just different things. And I think it's important to look through various ones to find the one that's like good for you and that you like, because not everybody likes the same noises. But I mean, I think for some people, doing their own ASMR in real life by touching certain textures, if that's what makes them feel relaxed, I think that that's a good idea to do too.
We have a question. What does it stand for?
I don't know. I have no idea. I just know that
not do our research.
Google ASMR, things pop up.
I think no one knows
Sally,
what that means.
Sorry.
It's just the latest, greatest thing on YouTube. ASMR and mukbang, which
and
I
the people
still...
who do it, yeah, they call themselves ASMR artists. So
you say that again, Natalie. Say that again.
The people that do it, they call themselves ASMR artists. ASMR artists. So I don't know.
Oh, interesting. Huh. So I'm just gonna go back to what we said Monday night, Natalie. Googlealo, Sally.
Yeah, Google it.
I found it.
She'll go look it up. Oh, you did? Okay, great.
Yeah, it says autonomous sensory meridian response.
Okay.
Meridian
I had a feeling it had to deal with sensory, but I don't know about the rest.
Okay, I'm going to put that up just so you can see. It's in the video now, and we looked it up. We Googled it ourselves and provided the information. Autonomous sensory meridian response. That is ASMR. Thank you, Sally, for your question. Oh, Marcella put it in the chat. Thanks.
That's fun.
Okay, let's move on to, I was curious about this one. 72 phrases to calm an anxious child. Is this?
So this is more of it's something that I use more for parents. So like I mentioned earlier, the majority of my caseload, I have a lot of little ones. And so oftentimes there are parents who are like, don't worry about it, or, stop worrying, or, they'll say things like that where, there are different forms of kind of normalizing feelings. It's okay to worry. It's okay to be nervous. but let's do something about it. Let's do, and that's kind of what this is. It's a PDF. It's not a book. It's a PDF file that I have, and I'll kind of go over certain phrases depending on the family. So I go based off of what's going on, and I'll kind of teach, try saying this instead. So some of the things are that I've practiced with parents are kind of, telling your kids, well, let me worry about it so you don't worry about it, kind of indirectly saying, you rather than saying don't worry about it, let me worry about it so you don't have to. Another one is let's see what science says about it. So again, going back to the kind of like we were talking about COVID-19, so knowing your sources. So let's talk about, let's look for some good sources rather than just dismissing the feeling. And 72 phrases to calm an anxious child. There are literally 72 phrases in there on how to, and those were just some examples. There's literally 72 phrases to calm an anxious child. Those are some of the ones that I've gone over with some parents, along with some other ones.
Cool. If it's something that you want to share, we can share that after this is posted.
Okay. Yeah, I can email it to you if.
Yeah, perfect. And then we can add it to the. Okay, so here's. I don't know if this one needs a whole lot of explanation, but mindfulness is something that, especially at school, there's a lot of this conversation. So who wants to tackle this as an explanation for coping?
I can talk about it. So with mindfulness, the way that I kind of go over, I try to use it a lot. In fact, I have these activity cards that I use with my clients and families, where I do talk a lot about mindfulness. So I begin with kind of talking about how it's important to be aware and accept your feelings. So mindfulness is not about clearing your mind. It's not about not thinking about anything. It's about accepting and being aware, non-judgmentally, about what's happening in the present, including about your thoughts, feelings, and your senses. I also try to kind of explain some of the benefits of mindfulness. So reduce symptoms of depression and anxiety, improved memory, focus, and mental processing speed, improved ability to adapt to stressful situations as well, reduced rumination, so negative thinking, and improved ability to manage emotions. There's various forms of mindfulness, but one in particular that I did want to talk about was more on, and I think I had sent it, it's the melting ice game. And these are the cards, I don't know if these are the cards that I use. So there's a whole bunch of cards in here that we practice mindfulness with, and they're games. And one of them that I love to use is the melting ice game, where I have someone, hold ice in their hand. And that's a lot safer than, hurting yourself or anything else really. And the worst that can happen, it's going to be cold and it's going to melt. And so I have them kind of hold it in their hand. And before I have them hold it in their hand, I have them think about how they're feeling, what they're thinking, how their body feels. And then I have them hold it and focusing more on those feelings and thoughts, and the difference between that reaction of wanting to let go of it and being aware of how they're feeling and those thoughts that are running through their mind as they're holding on to that ice. And after obviously it melts, I kind of just process with them the difference between the beginning of holding on to that ice and then during holding that ice, and just more on kind of teaching them to accept and be aware of their feelings.
I really hope that when people go through and watch some of these tips that you're sharing, that as adults that we're listening, because I know that your focus is children, and maybe focusing on like the K-12 demographic, but all of these things as adults, again, especially this last year, but just in general, these are good techniques, and they're simple, and they can be quick to just kind of reground us. And I don't think we give enough credit to how well these things work. And we just have to find the right one, right? That works for you. I love that the ice. That's a great before and after, like a great physical before and after example. Okay, so we've got physical activity and progressive muscle relaxation. Are those related, or should we talk about them separately?
Well, I'm the one that put in physical activity. And what I was thinking about when I sent that one in is I know sometimes when people have anxiety, they feel really jittery. And like if you have a lot of energy bottled up. So doing something physical, like going for a run or dancing or moving around, can help release that energy so that you feel less anxious. And that's what I was thinking about when I sent in physical activity.
Yes, we should all be getting our workouts and exercises anyway. And it helps with anxiety, so win-win.
Yeah.
Now, is there a big difference between an explanation for what this progressive muscle relaxation is? This more of like a technique?
Yeah. I guess I could talk about it, or Kanui, did you want to talk about it?
Well, I think Yanni,
I can talk about it. I mean, yeah, it's more of a like a muscle tension relaxation form of skill. So kind of like how we were talking about earlier, that with anxiety, it's not just, it's a mind and body thing. So it takes a toll on your body. And so with progressive muscle relaxation, you're tensing the muscles of your body. So it's more of a guided skill, where the way that I teach it is more, it's guided in the sense of, so relaxing the back of your neck, your shoulders, and then going into a fist, and then relaxing your legs. So what I would do, how I teach it is, I have my client look up to the ceiling and count to 5 backwards. And as you're looking up, you're kind of, tensing that muscle in the back of your neck, where you hold most of that stress. And then I would have them bring up their shoulders up to, almost touching their ears. And again, counting backwards from 5 to 1. And then within, after those counts, I also have them take in deep breaths as well. So inhaling through your nose and exhaling through your mouth. And then I have them bring their fists and tighten them up really tight. And again, counting backwards from 5 to 1, and then taking a deep breath and releasing. And then I have them clench their toes. And same thing, count backwards, 5 to 1, and then take a deep breath. And towards the end, in fact, I use that at bedtime to kind of be able to sleep, because at night I do have trouble sleeping. And so that kind of puts me to sleep. And so it really does relax the body. It kind of, especially if you've had just like a really long day, it's a stressful day, and it really does help. And it doesn't always have to be at bedtime. It can be, for us adults during work time to just kind of relax. And for kiddos at school, or any stressful situation, because like I mentioned earlier, it takes a toll on the body. So tensing those muscles relaxes the body.
I love that so much. I love it just because we don't pay enough attention to just our body parts in general, right? Unless we sprain something or hurt something in some way, we're not paying attention to our toes. Yeah. Right. So that really does bring you right back. I mean, even when I was doing the fist, and then I'm barefoot right now, so I was doing the toes while I was standing here, and I'm like, yeah, that does really make you focus. So then when you release it, you really do feel it again. That's like the before and after feeling that you want from something like this when you're trying to cope with anxiety. Okay, take that one off. Okay, one more time. It's autonomous sensory meridian response. Don't forget. Now we know what it is. Okay, so we're getting down. We're getting up to the top of the hour. We have a few minutes left. Is there any last few words of wisdom before we say goodbye?
Yanni, Natalie, feel free to kind of chime in. There's this book I read by a man named Archibald Hart called The Anxiety Cure. And there were two things in that book that really stuck out to me. I never forgot it. And I just wanted to offer that now. There are two things about anxiety. One, that is kind of creates that angst feeling. One is always being in the future. I found myself like in the car with my husband, like, what are we doing next? What's the next, like always on edge, always into the next 12 minutes instead of being, which, has a lot to do with mindfulness, being present instead of being in this particular moment. So, we want to be present emotionally, inwardly, but it's also past, present, future. It's also you're here today, right now at 6:57. So anxiety will bring you into the future, and you're always into that. And a lot of times when you're in that, you don't get to enjoy the moments of the day to day. So that's the first thing, is to remind yourself, what time is it? 6:57. I don't need to be in 7:15 right now, because 7:15 is creating anxiety for me. At 6:57, I'm right here. This is what I'm doing. So that helps. The other thing is, the question that anxiety asks is this: what if? What if, like I said, as a young mom, what if my son dies? I wasn't able to breastfeed, so everything, and I was on the La Leche League, and they, if you don't breastfeed, you're like a murderer. Certain. And so what if I can't breastfeed? And so then I had to, so with the way to answer that question, what if, is, so what if? So what if I can't breastfeed? What does that lead to? Well, then it leads to formula. So what if I have to give formula? So you begin to talk yourself down off of the ledge by answering those, targeting the question, asking yourself, digging through what you're really anxious about, and then also answering those questions. And when you answer those questions, you realize, I'm worried about, about nothing. So those two things.
Those are great. What was the name of the book again? Sorry, the two things
Yes,
about anxiety.
Archibald Hart is the author, and it was called The Anxiety Cure. The always in the future part wasn't in that. It was just in my head. I'm in tomorrow. But the what if question, really, I never forgot it. I read that book probably 15, 20 years ago. Those are things I never forgot. That was very helpful.
Well, thank you for sharing. That's a great way to end. Do either Natalie or Yanni, do you have any additional tidbits?
Just mindset. So kind of like what Kanuli was saying. So having more of that positive mindset of what if I can, and just challenging that negative mindset, and it'll me not, because the future, like Kanuli said, the future, it's unknown. You don't know what's going to happen at 7:15. So mindset. Right. What if I can do it? So just having more of that positive mindset.
And if you need help, talk to someone about it, and they'll help you challenge those thoughts for sure. Because sometimes it's hard to do it for ourselves. But if you go and talk to a friend, they might be like, okay, so what? And then they might help you be able to think about, other stuff.
Yeah, it does seem like you could text a friend and say, what if this is happening? What if A, B, and C? And they're like, okay, but what about D? And then that's all you need is for somebody to tell you.
Yeah.
And that's like a quick shutdown of some of those things, I think, sometimes if you have good friends to help you through that. Okay, well, we're doing these Therapy Thursday sessions because May is Mental Health Awareness Month, and the clinic wanted to make sure that there was a space for us to share your clinicians' expertise in this local area. So hopefully everyone's enjoying and learning and sharing what is going on during these sessions. We have one more next Thursday. We'll continue the conversation about anxiety and have a little more in depth and some more tips on maybe where to get help and maybe more coping. And then I want to remind everyone, because it's what I do, that this is also Asian American and Pacific Islander Heritage Month. So again, please use Google. It's an amazing tool. And I've been saying on our book discussion time on Monday nights that Netflix and Hulu and Prime, like all of these streaming services, are making it easy for you to get this information and support these communities. And then also, read books, listen to books, watch TV shows, talk to people, join clubs, whatever it is, but definitely use the tools available to us during this time to become more aware and considerate of our fellow human beings. And, it is Mental Health Awareness Month, and all of that goes together because we know that a lot of those issues cause anxiety and stress in people that can lead to other more serious health issues. So if that's it, then we will see you next Thursday. Thank you so much for joining us. Thank you, ladies. Have a great weekend, everybody.
All right.
Bye.